All right, so today I am going to talk to you all about our HIV modernization laws out here in Nevada and how we got those passed through a coalition-based perspective. So just a little bit about myself. I'm the State Director for Service Data Quality. We're a statewide LGBTQ+ civil rights organization here in Nevada. I lead everything that we're doing out here right now. I have a background in human services. And I am currently a member of Governor Sisolak's advisory task force on HIV modernization, which I'll talk a little bit about in just a few minutes. So again, with Service Data Quality, our mission is to bring the voices of LGBTQ+ people and our allies to the institutions of power in Nevada and across the United States, striving to create a world that is healthy, just, and fully equal. We do that by passing pro-equality legislation, getting pro-equality candidates elected to office, and working on advocacy and education around like get out the vote and other health and well-being categories. And then we also try to do some work to advance civil rights to the courts and the like. And so today I hope to provide you an overview of the work done and lessons learned here in Nevada to successfully modernize our HIV laws through coalition building. And so first I want to start off, and I'm not sure if folks are able to jump off their microphone and chime in or just write in the chat. But I just wanted to start off with some general questions from folks and ask someone or you all, what is the criminalization of HIV? If someone can just chime in with their own definition of the criminalization of HIV, that'd be great. What does it mean to have laws that criminalize people living with HIV?
I would say charging people for crimes just for possibly unknowingly transmitting HIV.
Yep, that is a portion of it. Yep. Anyone else?
Also, the increasing of sentencing based on HIV status.
Yep, exactly. Yep. And the next question would be,
Andre, I'm sorry, I'm going to be backing you up and manning your chat, but there's some, a couple came through in chat that you may not have seen. So laws that make it a criminal act for a person with HIV to do anything in their private life that would otherwise be non-criminal. And then that's from Delio. And then Tamio, hopefully I'm saying that right, like crimes for non-disclosure.
Awesome, very good. So I think this concludes my presentation. I don't think I need to do anything else. So, so that second question, as a follow-up, which is on the screen, what populations of folks do you think are mostly impacted by these HIV criminal laws? So I'll give folks a chance to chime in verbally and some comments right in the chat. So who are mostly impacted by these laws?
People of color.
Race, gender. Go ahead.
Well, people of color, Black, men who have sex with men.
All right, very good. Anyone else?
Trans community.
I think I heard the trans community.
And Andre,
so, very good.
In chat, you have MSM population, communities of color, some of the things that have been shared thus far, people living with HIV, and sex workers.
Very good, awesome. So broadly speaking, HIV criminalization is a term used to describe laws that criminalize otherwise legal conduct or increase penalties for criminal conduct based on a person's HIV status, which you all more or less have already said. And so in Nevada, we had 2 HIV-specific criminal laws, which criminalized 3 categories of conduct. So engaging in prostitution and solicitation after testing positive for exposure to HIV and receiving notice of one's results, and then working as a prostitute in a licensed house of prostitution after testing positive for.
And Andre, you became muted for some strange reason. So you just need to unmute. We can see your lips moving.
Okay, how about now?
There you go.
All right, perfect. And then there's intentionally knowing or willfully engaging in conduct in a manner that is intended or likely to transmit HIV to another person. So those are some of the things that we had to address out here in Nevada. And as we mentioned earlier, those engaging in sex work are some of those impacted people when it comes to these HIV criminal laws. And so if we go back in time, really across the nation, these laws were implemented in the 1990s as part of the Ryan White CARE Act, which required states to have measures in law that would prosecute folks who knowingly expose someone to HIV. And out here in Nevada, and we can read this in the legislative history, there was this guy called Dr. Paul Cameron, who's since been removed from the American Psychological Association, Sociological Association, some of these other state groups, where he talked about men who have sex with men and prostitutes as these vile people who were out there intentionally transmitting HIV to other people. And this alarmed a lot of folks in the legislature at the same time that we were striking down our sodomy laws here in Nevada. And so all of this rhetoric was spewed out in our legislative session. And it was just a whole bunch of stigma, fear, and misinformation about men who have sex with men and people engaged in sex work. And so for our laws, it didn't really require for someone to actually infect someone with HIV. It could just be someone who spat on someone else. And we know nowadays that that's not a way that HIV is transmitted. But back then, that was on the books as a way that someone could be persecuted. And so these laws had maintained on the books for like 20 some odd years. And it didn't really require someone to actually be infected or intend to infect someone. And lastly, in addition to like biting, there's scratching and other means of ways that people thought HIV could be transmitted, which would fall into that category. And so as we're kind of talking about earlier, the folks who are mostly impacted are the Black community, Latino people, and other people of color. It disproportionately impacts women and transgender folks and sex workers. And what it does is brings these individuals into the criminal justice system who otherwise wouldn't be brought into the criminal justice system. And so it creates complications for folks to advance their lives. And with these HIV criminal laws, from a public health perspective, we have seen that it can deter people from getting tested. And we know men who have sex with men and Black and Hispanic communities in particular very much need to get tested and know their status. Because we know that once someone knows their status, they're less likely to transmit the virus. And then there's stigmatizing language, not only in the legislative, in the statute, excuse me, but it also stigmatizes people as if you're living with HIV, then therefore you are at some point trying to infect someone else with HIV. And ultimately, when you're trying to get folks to get tested, know their status, and be a part of public health initiatives, if these same folks are at risk of being criminalized, then you're very well not having them engaged. And so folks are being impacted in several different ways. And so we mentioned that Black people, Hispanic people, sex workers, women, and we'll have to add young people as well, are mostly impacted. So what does that say about coalition building? If we know that, who do we need to have a part of movements to change these laws? And opening up for folks in the audience, what needs to be done if we know who is mostly impacted when we're coalition building? What do we need to consider? What we need to do is make sure these various folks are a part of the coalition to advance the changing of these laws. So we'll need to reach out to folks who are living with HIV or not, who are Black, Hispanic, women, transgender folks, sex workers, to be a part of the coalition to advance changes in the law. So if they're mostly impacted people, you want to make sure that those people are a part of the effort.
Andrew, there's also a comment in chat saying invite lawmakers to the meetings of these coalitions. Very much so, yes, because there is a big education component to policymakers and stakeholders if we want to get them on board. And I believe I'll touch on that a little bit later. So thank you. And there's another comment. There's somebody's asking, what about also educating the broader public so the burden doesn't always fall on those most impacted? That is exactly right. Yep. And so when you build coalition, you can have folks that are not only directly impacted, but allies to help support the work that needs to be done. So very good point. So what we did out in Nevada, and it was not a clean, linear process by any means, and I think we all sort of have to realize that it's really rarely a straight line. So we reached out to folks who are sex workers. They have their own community and convening body. So we reached out to sex workers because out here in Nevada, you have legal sex work and licensed sex work and unlicensed sex work. And so there's our different bodies that support each other from a sex worker perspective. Have to make sure we have people living with HIV a part of the coalition as well, and these partner organizations that are in the progressive space that maybe they don't work on HIV related efforts, but this is something that they can be folded into from a criminal justice perspective or a based upon if they work in spaces that are solely for like Black communities and Hispanic communities, et cetera. And so identification of those stakeholders. So someone just mentioned reaching out to lawmakers and making sure that there are other folks in the coalition so the people who are impacted don't have to always lend their voice and tell their stories. And so if there are any sort of pre-existing coalitions or partnerships for you all to reach out to when doing any work, that's the best way to sort of have a built-in mechanism, just as we did. There are already these different coalitions and groups that we work with in different spaces. And so we just simply reached out to them to get them on board and educate them on HIV criminalization laws. So we had a unique opportunity out here in Nevada. So for quite a few years, there's been this governor's task force on HIV modernization exposure
And with the passage of a law in 2019, it reconvened. And so this advisory task force consisted of different folks from across the state, people living with HIV, advocates, and people in the healthcare space. But we had difficulty recruiting people who were living with HIV to participate in this governor's task force. And there was conversations about whether or not through the application process, when it asked if you've had like prior convictions or these other things that the governor's office should be aware of, was that something that prevented folks from not wanting to apply? I don't know what oops. Wait 1 second. Oh, lack of gender diversity. So when we formed the task force, it was up to 15 seats, and eventually we got to like 9 folks, but there was only one woman who was a female legislative person, and so otherwise there was no female representation. And so there were a lot of a particular group that wrote letters to the task force members and the governor's office to question like why were these appointments done where no females were a part of the task force. And so eventually that was resolved. But I will say it was not an easy time because we're right in the thick of COVID in 2020. And so the governor's office was dealing with COVID, and a lot of other issues of racial protests were happening as well. So again, one of those things where it was in a clear process, but at the same time, there were some folks that were left out of the task force. And so there is a coalition, HIV Modernization Coalition, which is separate from the task force, and they were made up of fairly diverse individuals, including people living with HIV and allies. And there was a point when they offered cultural humility training to their members so folks could have a better sense of being respectful and aware of different people's perspective as it relates to their gender identity or their race or even their if they're differently abled. But even the coalition had difficulty recruiting and sustaining new members. And so even though we knew that we wanted people who weren't directly impacted to be a part of the coalition, we wanted people who were allies and from other groups, it was still difficult to get folks to join the coalition and stay a part of the effort. And I will note that the sex workers, although they were interested in participating, no one did. And so we touched base with them periodically to let them know how things were going during the legislative process, but no one actively participated. But we did try to get them to do so. And I'm not going to go over these point by point, but I just wanted to give you a sense of what the duties of the governor's task force were and are, because we're still meeting. And it can be sort of overwhelming where you can look at these different things that need to be done and may not see yourself as playing a role in helping out. This can be very sort of esoteric for folks. So, just because you're living with HIV or you're impacted in some way doesn't necessarily mean that you have a clear understanding of the nuances of HIV and these modernization laws. And so that in itself could be a barrier for folks for being engaged. But these are some of the things that we had to do to help write a report. And we did it within like 2 months. Instead of having a year to do so, we did this in 2 months. And so it was a lot of meetings and a lot of time, again, which could be a barrier for folks to be engaged. So what guided the principles for the work that was being done was this elements of modernization. And I mention this because these are elements that have been created and understood from a national perspective to do the work. And so we're taking what has been said needs to be done from people living with HIV in this advocacy space to move forward the work that was done in Nevada, which was really important to make sure that we have this as points that guided the work being done. I'm just going to pause it there just so people can take a quick look. All right, moving on. So just so you are aware, some of the changes that we made in this legislative session was we made it so these codes were taken out of the criminal code and moved into the public health code. So this is a public health issue, it's not a criminal issue, which is huge because you don't want impacted people to, if something happens from a legal perspective, to automatically go to criminal codes, because then prosecutors are going to think from a criminal perspective and go all out with their intent to do the work that needs to be done. So we moved it from public health, from a criminal code to a public health code. And there were all these incorrect references to AIDS when it should be HIV. Again, these laws were written in the 1990s, and so people just said AIDS about transmitting, AIDS from one person to the next. We know that that's not possible, so we have to go in and update that information, which can also be stigmatizing for folks living with HIV. And we wanted to create a affirmative defense. So if a person is exposed to a communicable disease through conduct, if they know the defendant has the communicable disease, whether or not the conduct could result in transmission of the disease, was their consent to engage in contact with knowledge that someone was living with HIV, and if the potential exposure to a communicable disease, if the person who has the disease was not likely to expose another. And so all of these things, we wanted to take the burden from folks who were said to have transmitted HIV intentionally or unintentionally to those who were making the claim. So some of the lessons learned that we needed to educate lawmakers and stakeholders on HIV in general, and then HIV modernization specifically. So someone mentioned earlier that there's a need to bring in lawmakers, and that's absolutely correct. And in doing so, you have to have these conversations with folks, which we did, but we didn't have these conversations with the entire legislative body. And so when we were in sessions and during the hearings, you would have people, legislators, saying things that was what they learned about HIV back in the 80s and 90s. And so it took some time to navigate those waters. And Senator Dallas Harris, who a Black queer woman who sponsored this bill, did a fantastic job of navigating those waters. But we definitely recognize, when we have conversations like this, to let other folks know that it's really important to educate lawmakers and stakeholders across the board as much as you can, which would also include prosecutors, the courts, and other folks who are part of the coalition. What we felt that we needed to do a better job of was engaging the criminal justice system earlier, but then also making this a criminal justice issue to our partnering organizations, and also making this a public health issue and an issue that's based on equality for LGBTQ space, and also for the Black liberation issue, because we know that Black people are more likely to be harmed by these laws than any other group. So when we talk about structural interventions and building foundations for the movement, there are some things to consider when you start building up your team. You're having folks who are coming to the table with their own perspectives, backgrounds, ideas, relationships or tarnished relationships. And so most of us who have experienced coalitions know that it can be very difficult work, emotional, time consuming, mentally draining, just to get people on board and make sure that they feel heard and not marginalized in the coalition as you're working on the same issue. And so it's really good at the beginning to start with setting the foundations of what the work is being done. What are some of the non-negotiables with the work being done? What are some things that you, if we're going through the process and if a certain statute doesn't pass, like, are we okay with that or are we not? So having to have these conversations with folks is really important as you outline what your goals are and what are the roles of folks? Are there particular leaders of the coalition who have particular backgrounds, maybe from communications, or they're good with telling their personal story? Maybe there's organizers. So being able to figure out all of these things to help build that that coalition up. And so as you build up your coalition and you're bringing in different groups of folks who are impacted, allies, supporters, all these sorts of things, we always want to try to keep our eye on the work, but often you can easily get distracted by some of the interpersonal issues that are happening within a coalition. And so it really takes folks the ability to have conversations about what it is they hope to accomplish, why and when and how on an ongoing basis, because these are conversations that need to be revisited all the time because people are coming from, again, all these issues with different perspectives and backgrounds and expectations that can easily play out. One thing that we had happen for us was working with local groups, statewide groups, national groups, everyone having their perspective, and certain members of either the coalition or the governor's task force either siding with what national groups wanted and thought should happen during the process, and some folks being more mindful of what folks in Nevada and wanted and some of the history that was important, because there became disagreements about the path forward, and all these different factions started to develop, which is quite common, but it was almost to the point where this effort could have imploded because people were starting to threaten to send out emails and tweets about what they thought should be done and what somebody said in some meeting and this and that. And so it became like very contentious at one point. And luckily we were able to solve for some of that. But again, when you're bringing different ideas and perspectives into the picture, some of these things, unfortunately, can happen. Because what we're dealing with is what is wanted from people who are funding these different efforts. We had a case where one of our members, when we talked about engaging law enforcement, one person thought that that meant that they had to then interact with law enforcement themselves to have these conversations about HIV, and that was triggering for them. And that wasn't the ask, that wasn't the request, but that's how they interpreted it. And so we had to let that person.
Okay, Andre, we lost you again. And just for, just a heads up, if anybody else has their mic open, if you can just close it for us. We hear a little kind of noise in the background. But yeah, Andre, we missed you for a second. I think you're back.
Okay. You didn't miss much. I paused. But what I was saying was we had to let her know that there's no need for you to interact with law enforcement in that way that's going to be triggering for you. And it took some time to calm the person down. But again, that's someone bringing up their past traumas to the work that's being done, but you still have to be respectful. So ultimately, we have the bill passed, and there was some agreement overall with the path forward. But there was one point when a national group who felt that they were leading this effort that was happening in Nevada, which was not the case. They were willing to, during a legislative hearing, to go against some of the points that were being made. And I had to have a conversation with the executive director of this organization to say, like, if you do that, you're throwing a bomb into this entire effort, which can ruin everything. And that led them to not do what they planned to do. But it was a conversation that needed to be had because this person was bringing their own perspective from a national perspective, from their own trauma, and from their own thoughts about how the work needed to be done. They were willing to disrupt that simply because they felt that how they wanted things to happen wasn't happening. And so as we are at the end towards the closure, I just wanted to open up to everyone to verbally or place in the chat some answers to the questions that are on the screen now. So one question, are there any examples of when you had difficulty recruiting impacted people for a particular initiative? What was the workaround or solution? And it's nothing like seeing typos when you are reading your slide presentation, but nonetheless, in general, are there any examples of when you all in the audience had difficulty recruiting impacted people for a particular initiative, and what was the workaround or solution? We'd love to hear some experiences from folks in the audience.
I mean, I can say, this is Raj from the County of Santa Clara in California. One of the things that, being like a government institution and with our strict laws and, I mean, not laws, but our guidelines around like, giving out, you have to get board approval in order to give out incentives, any kind of monetary value of anything. And so that becomes difficult when recruiting folks. One of the go-arounds that we have is we have an HIV commission, which is it's hard to fill the seats and everything. I mean, we aren't incentivizing those seats, but that's a way that we are able to move some of our work around this area. But the incentives piece has been really difficult for us.
Thank you for that. I'm sorry, what was your name again?
Raj.
Thank you, Raj.
No problem. Thank you.
Awesome. Anyone else, please? All right, there's no one else. I'm going to go on to the next question. So how can we get people to actively participate in policy initiatives when the weeds of the subject matter can be dense and overwhelming? Sort of intimated that in doing this work around HIV modernization, that it can seem like a lot to be asked to do research and look at data and come up with what's happening in other states. So what can we do to sort of make it easier for people to participate in something that can actually be or seem dense and overwhelming? Any thoughts, any experiences from you all?
So Andre,
You might
there's,
have a comment in the,
yeah, I'm sorry, you
Okay.
already see it, go ahead. Would you like me to?
no, I can only see that it's something there. If you could read, that'd be great.
Okay, so Jenna says it can be difficult to get the homeless and substance users involved. So we use incentives, but they're not enough to get this population motivated. And then there's another comment from Delio. Language should be geared towards the people reading it.
That is absolutely true about language. Like personally, I love fancy words, but that could very much turn people off and not be helpful at all. So very good point. And I would put sex workers in the same category, so to speak, in this conversation about people who are experiencing homelessness and who are abusing substances. That it's hard to engage. We have not yet found a solution out here in Nevada. We've reached out to folks again to see if they would be engaged in the process. And incentives might be something that if funding allows and bureaucratic ease allows to get some of these folks to actively participate. Any other thoughts or ideas or experiences?
So one of the things that I think I may have overlooked, so Delio also mentioned that infographics have been a way of, have also been successful, I guess, in helping to gear information towards the people who are reading it. And then somebody seconded Delio's comments, and that was Lolita.
And I would also remind us, yesterday we talked a little bit about some ways to engage communities. And so, you know, remember those things like provide opportunities to volunteer or conduct community forums, and certainly share any data that you're collecting back with the community. And that can really help gain buy-in from community members.
That is exactly right. We offered to meet sex workers where they were at, where they regularly would convene and whatnot, and it never happened. But we were trying to find a way to get the information that we had to them, and we actually created an infogram where it easily showed that, at least in Nevada, out of all the communicable diseases, HIV was the only one which would be a felony offense, and it was just clearly stated in a chart that someone could just easily look at with few words versus just having this pages and pages of like the argument around it. So the use of infograms is definitely a good look. And so the last question I wanted to ask you all, because I'm also taking notes, so if you all have some good ideas, which you do, I'm writing them down for my work. So what are some ideas for addressing the different factions and interests from different stakeholders that may cause problems for an overall coalition? Now, I mean, that's the key to coalitions, right? Like everyone's bringing their own stuff to the table, and you have to find a way to work through that. So I kind of addressed it earlier in some of the slides, but we'd love to hear from you all some ideas about addressing how these different factions or small groups can start forming that might be disruptive to an overall coalition.
So
Hi,
a comment.
Andre. Oh, Hi, sorry. I actually, with the second one also, one thing that actually just popped in my head is using social media, using targeted marketing approach, to focus people who are passionate about this work and, utilizing influencers as well. It's definitely a way to get people energized and motivated and reach the targeted population, in a very simplified manner.
Thank you. Awesome.
And there's also a comment that came through chat. It may have been in response to the last question, but Aaron writes, would survey/interviews work in place of asking people to give time to a coalition? Just as they say, I think that it can be hard for people to get involved in ongoing coalitions when they're focusing on meeting other basic needs.
Absolutely. Now that Aaron mentioned that, I feel like what we should have done was talk to some of the sex workers and other people just living with HIV to ask them about their story and write it out for them instead of asking them to either attend a hearing and speak and write their own points. If they're willing to have a conversation, we can just write that out for them ourselves. So that's definitely a good point. Out in Chicago, they did a survey of folks to try to get information about how they felt about HIV criminal laws and the like. They had a low response rate, but they also recognized that the survey was probably too long. So going back to that notion of people don't want to read all this information, people don't need all that stuff. Like, we just got to keep our surveys and information succinct so people are able to engage and digest the information. So thank you all very much for that.
And another strategy just came through from Timo, like host lunch and learns to have those honest conversations. Invite the community to have a seat at the table.
Yes. Yes, yes, yes. I'm writing right now. Host lunch and learn. And I think that's a very good point. I think we didn't do, well, I know we didn't do it because we were in a COVID situation, but for the work that we're continuing out here in Nevada, I think a lunch and learn and getting in front of folks would be very helpful, because we're still continuing the work. Even though we passed a comprehensive bill, we're gonna see what else needs to be done. So I really appreciate you all's time. I'm going to see if there's any closing thoughts, questions before we close things out. But I want to thank you all for your time and attention and your feedback as well. So any final thoughts or questions from folks?
Go ahead and feel free to unmute or place them in chat.